In this video, we're going to talk about two different ways to enlarge the scrotum. Now, first of all, why might somebody want to enlarge the scrotum? In my practice, I do a lot of testicle enhancement, and some patients prefer to have quite large testicle implants placed. Now, there has to be room for the testicles within the scrotum, and not every scrotum can accommodate a large pair of testicle implants. So, in situations where people have aspirations to get larger testicles, these are two suggestions I have that might help with that. So my first suggestion is always going to be scrotal massage, and what I mean by that is stretching out of the scrotal skin itself. So this is going to take a lot of dedication and a lot of time, but I have seen it work. It's slow. We definitely don't see any change for at least 6 months, but it's possible. So basically what we're doing is we're using the concept of tissue expansion in order to do this. And we know, for example, there's a phenomenon called creep or mechanical creep in the body. When we put a prolonged mechanical force or stress on a tissue, it'll grow. And of course, we know this from gauges, for example, in the ears, where we put a stretch on this tissue and slowly but surely it can grow to quite impressive sizes over time. The second thing we can do to enlarge the scrotum is Botox or Scrotox, or I actually prefer using Dysport, which is another type of botulinum toxin for this. So we can target two different types of muscle. We can target in the spermatic cord itself. We have the cremasteric muscles, and we can inject some units into that, which will lower the testicles that are there naturally. And also the scrotum itself is made up of a muscular layer, the dartos layer, and so similarly we can inject broadly over this muscular layer in the scrotum, and this does definitely help reduce things. Usually we don't see any results for about 3 days, and unfortunately the thing about Botox is with time it wears off. Depending which study you read, it lasts about 3 to 6 months. It also depends on how much of a dose you give the patient. We usually need pretty large doses for this because there are a lot of muscles involved, so this isn't readily accessible to everybody. But I do suggest this sometimes in patients where there's maybe a little bit of doubt as to whether they can accommodate the implants and do it ideally before surgery or at the time of surgery. We do know the risk of extrusion or loss of an implant is bigger the bigger the implant